Welcome, everybody. Today's kind of just an introductory class to kind of get you situated to the office. But I guess how we start is with our mission in the office. Our mission in the office is to literally revolutionize the community's expectations of their health, human potential, and pediatric development. So a big part of how we do that is through education. So that's what we're going to do. Today we're going to do two things primarily. One, we're going to give you kind of an outline of what your care is going to look like over the next couple of months. But more importantly than that, I want you to have a greater understanding of what chiropractic's all about. Chiropractic goes far beyond treating your aches and your pains and your symptoms and your conditions. Chiropractic's all about living a healthier life. It's all about maximizing the expression of your life. Make sure that you're as healthy as you possibly can be. Because the reality of this is we're in the middle of a healthcare crisis. So research shows that 1 out of every 3 of us will die from some form of chronic disease, meaning chronic diseases are diseases that are 100% avoidable. They're just the result of bad health choices. So, I would tell everybody, look to your right, look to your left, and if they look better than you, that 1 of the 3 might be you. So this is something that touches every single one of us. So when we talk about, maximizing the expression of life, what does that mean to you? So Darren, what would you say? I want to maximize the expression of my life. What would you say? What does that mean to you?
Be vital.
Vital.
Vitality.
Cindy, what do you think? What about you?
Positive energy, be able to do more and
Be at your best.
and be at my best. Yeah.
Good. Dave?
It's too early in the morning.
Too early in the morning. I'll ask you when you're done your coffee. How about that? But, your body is truly amazing. By the time you're done reading this sentence, 50,000 cells in your body have already died and then been replaced by new ones. We're constantly recreating our bodies. Your skeleton is actually brand new every 3 months. Your skin is new every single month. So, we're always in the process of repairing and breaking down. And if you can repair your body at a faster rate and that your body breaks down, you're going to be healthier. And that's the ultimate goal, isn't it? But if your body is breaking down faster than it can repair itself, you're going to be sicker. If you take a cell, and it doesn't matter if it's in your body or if it's in a petri dish in a lab, it's near impossible to take an unhealthy cell and turn it into a healthy cell. So how your body gets healthy is when your unhealthy cells die and they're replaced by healthier cells. That's how we get healthier. If your unhealthy cell dies and it's replaced by a cell that's just as unhealthy, will you be any healthier? Absolutely not. So what we talk about with chiropractic, and we're going to talk about it a little bit, is that when your body has a proper nervous system function, it's able to repair at a much better rate. The average human heart will beat 300 million times in a lifetime. Scientists have found over 500 functions in your liver. Imagine if you had to be conscious of that. For instance, everyone woke up this morning and probably said, man, I am busy. I got tons of stuff to do today. But did anyone wake up this morning and say, man, I am busy, but my pancreas is not going to get a break. My liver has just got this agenda today. It's not going to get any breaks. Everything that keeps us healthy every single day is totally unconscious. The human brain generates more electrical activity in a single day than all of the world's telephones combined. And that electricity travels over 45 miles of nerves just in your skin alone. We're not talking about the nerves that are inside running your heart, your lungs, everything else. So are we amazing or what? It goes much deeper than that. So what are these? We all know what these cells are, right? And this is what sperm cells look like in the absence of an egg. These guys are confused. They're all over the place. They have no idea what they're doing. You want to talk about focus? Add the presence of an egg. All these little guys are all lined up. So you want to talk about the miracle of life. The miracle that every single one of us have is, when we introduce the egg, how do 2 cells find each other through all that madness? 2 cells turn into 60 trillion in 290 days. I know I haven't done that much in the past 290 days. So during the delivery process, if for those of you that have seen a newborn baby, lungs that have never worked on their own are going to work perfectly. Heart that's never worked on its own, it's going to work perfectly. And if you look at a brand new baby, you can just say, oh my God, life is amazing. So my question to you is, at what point in your life does that miracle leave your body? When you cut your knee and then your body heals itself, that's the power that we're talking about, that each and every single one of us have. So the most important thing I can tell you today is that there's a power, there's an intelligence inside each and every single one of us. As a chiropractor, we refer to this as your body's innate or your inborn potential. So your body's, and of course we're talking about your nervous system, but of course your body's innate intelligence or your nervous system's messages comes from your brain. It comes through your spinal cord. It exits these tiny little windows here and exits these nerves. And these nerves make their way to every single organ, tissue, and cell in your body. So this is the energy that runs your body. It regulates every single function, but most importantly, this is the body that keeps you healthy and heals you when you're sick. So if you look in the testimonial notebook, you'll see stories of, oh, Dr. Chris cured my headache, Dr. Chris cured my backache, Dr. Chris cured all sorts of things you wouldn't even think of, like asthma, allergies, blood pressure, cholesterol. The important thing to remember is, although that's very nice that they gave me the credit for that, all my job as a chiropractor is to identify the areas of interference in the nervous system, allow that power to work the way that it should, so that your body works the way that it should. So again, we talk about only life can create new, healthier cells. Only life, only your body can heal. My job is just to find the interferences or the blocks to that. So when we talk about subluxation, that's really what a chiropractor does. Basically, through life, the delicate bones of the spine will shift from their healthy alignment. And it's no different than the alignment of your tire. When the alignment of the vertebra is lost, they start to break down, decay, and when that breakdown and decay gets to the nervous system, you can see how that could interfere with the messages that are coming through that spine. Does that make sense to everybody? So my job with an adjustment is to find those areas where there are blockages in your body's information superhighway, remove that with an adjustment, allow the nervous system to work the way that it should, and when that happens, your body gets healthier. I can't tell you how many patients have started care and they'll have some sort of condition. They won't tell me because they're embarrassed or they think that chiropractic can't help. And usually into care, at some point those things go away. But it's important to remember that it's not me that cured or fixed that. It's the body's intelligence. So everything that we do in this office is to empower your body, what it already does best. So many people come into the office to be healthier. The ironic thing is, health is already yours. It's your birthright to be as healthy as you possibly can be. So my job is just to facilitate that process and kind of coach you along the way. So when we talk about different things that we have to do, let's switch gears to talk about care within the office. We want to improve the quality of your life. And there's 4 things that we need to do. We need to look at the belief systems. We look at your standards and, of course, your strategies. And there's a responsibility that comes with these things as well that we'll talk about. So when we talk about your beliefs, a lot of the beliefs that we have are incredibly damaging to our health. When we talk about belief systems, I tend to feel like Christopher Columbus. Imagine the sales job that Christopher Columbus had to do when the contemporary thought was, yeah, the world is flat, and you sail to a certain point, you fall off, and then sea monsters eat you. Of course. Imagine Christopher Columbus. He had all the same information that everyone else in the world did, but he drew an entirely different set of assumptions from what he knew of astronomy and other different things. He said, no, the world is round, and no one else believed him. So some of the things that I'm going to talk about may appear as if I'm saying the world is round when everyone believes that it's flat. So all I ask is that you keep an open mind about this. So when we talk about how do we know if we're healthy, many people say, if I feel good, I'm healthy, and if I feel bad, I'm not. But what we know is how you feel is a poor judge of your health. When we think about, does anyone have a cavity? Right? Do you always have a toothache when you have a cavity? And when you finally do have that toothache, is that an early sign or a late sign of tooth decay? It's a late sign. So pain usually is your body's very last-ditch effort to say, I have a problem. It's like a baby crying. When a baby cries, you don't ignore it. It's your way of trying to bring attention to a certain area. When we talk about heart disease, it takes 15 years for arteries to plaque sufficiently enough to cause a heart attack. And if you've ever seen a person the day before a heart attack, they look healthy or do they look sick? Most of them look pretty darn healthy. When we talk about cancer, most people have cancer 8 years before they feel it. So again, most people find their cancer by accident. So again, we want to judge our body's health by how it's functioning, not so much how it's feeling. Remember when we talked about the scans that we did of your nervous system, and we showed you this chart. Remember, only 10% of all the nerves in your entire body even have the ability to detect and sense pain. So you have to imagine if you went through every day with only 10% of your visual field. You'd miss a thing or two, wouldn't you? So your body is the same thing. Remember how we talked about how 90% of the nerves run your body and only 10% of the things, nerves in your body feel what's going on? It's because every single day the pancreas has to do its job without you knowing it, the heart. Do you understand? In other words, there's about 90% more important things to do other than feel your pain. Make sense? So that's why we use the scans to change or to monitor your progress. When we talk about standards in this country, we're about 5% of the world's population. But believe it or not, we consume about 60% of the world's drugs. And we spend way more on healthcare than any other country. In fact, we're double number 2, which is Britain. We should be the healthiest. We spend the most money. We take the most drugs. We're the healthiest, right? World Health Organization rates us number 37. I can't even think of 36 other countries. So when we talk about our standards, we got to talk about 3 different things. The treatment of a diagnosis, the prevention of a disease, and promotion of wellness. Those are 3 entirely different things. So treatment of a disease is what has left us with our healthcare crisis, where we wait for people to get sick before we start to worry about their health. Remember how the body is always breaking down and repairing? This is when all of a sudden we're healthy, and then one day we wake up, we have a headache, a sniffle, a cold, a pain, and then we have some sort of symptom. We go to the doctor, they diagnose that symptom, they give it a name, and then they give a treatment or a drug that addresses the symptom. And when the symptom's gone, you're healthy again. So if you have high blood pressure, you go to the doctor puts you on high blood pressure medication, blood pressure goes down. Do you have high blood pressure? Depends on how you look at it. My blood pressure is fine. I take 7 blood pressure medications. It's all how you look at it. Prevention of a disease is not that much different from this. It says, hey, I know what gets me sick, and all I'm going to do is just avoid those things. So when we talk about promotion of wellness, that's where the future lies. I mean, everyone's getting this prevention of a disease. We all get this. This is a hot topic right now. But promotion of wellness is something entirely different. It requires a proactive action step that moves you towards a goal, which the goal here is health. When we talk about health, what is it? It's the state of optimal mental and social well-being, not merely the absence of disease and infirmities. So does it say anything about feeling good? Because when I have a fever, because I have a bacteria that's trying to invade my body, is that healthy or is that sick? What do you think? I think for me, if you ask me, I think that's a healthy response. Because if you didn't have that fever, you would die. Or if you eat some bad food, you start to vomit. That's not a good symptom, is it? But if you didn't vomit, you want that bad stuff in you? No. So feeling good has nothing to do with health. So when we talk about treatment of disease here, here we have 100% function. You're at your best. And then over here we have death. When we talk about treatment of a disease, again, our body will break down because of the stresses that we all encounter. And at some point, if our body's not regenerating to prevent that, we're going to fall back and we have a symptom. We go to the doctor, we get a drug, and that symptom goes away. But does our position on this line change? Not at all. In other words, the symptom moves, but you do not. So the strategies that we're going to talk about in just a second are things that are actively going to push you in this direction. Beyond that, your chiropractic care has a lot to do with that. Here's a study that measured something called serum thiol. It's a marker of how well your body is healing. And they found that patients under chiropractic care had significantly higher levels of this healing repair enzyme. Patients that were under chiropractic care longer had higher levels of this healing enzyme than patients that are under chiropractic care, shorter duration. And we see that in the office. I see the biggest healthcare changes in the patients that have been under care for a minimum of 6 months to a year. Your second year is usually the most exciting. So let's talk about some strategies. And when we say strategies, we're going to talk about things that, most of us are already acquainted with, but we're just going to put a different light on them. Kind of like this. Raise your hand if you see the white arrow. You see it now? So now that you've seen this white arrow, you'll always be able to see it. We're going to do the same thing with these strategies here. So we have Discover Wellness workshops, which are different workshops that we teach at different times. That's a great resource for you. Always feel free to bring friends and family with you. We have our website. Please log on to the website. There are tons and tons of research articles about really a variety of health and wellness topics. And the Metro West Wellness Initiative is me and a group of other healthcare professionals that do workshops for corporations and for groups. So we give you lots of different resources. Just try to meet us at least halfway as far as that goes. So we talk about strategy number 1. Exercise is very important. So healing requires oxygen, which is, of course, is in your blood. So the more cardio that you do, the more your body's going to lay down new capillary beds, or that's basically where your body delivers the oxygen or the blood. So again, the World Health Organization recommends about 30 minutes of moderate intensity exercise 5 times a week. So as we go through these strategies, I want these strategies to be our talking points over the next couple of months. I love to talk about the weather probably more than anyone else that I know, but I would prefer to talk about your health in the room. So as we go through this, it's okay, yes, I'm doing that. Or if you're not, we need to have a conversation about how we can make that more accessible to your life. So these are the bare minimum things that you need to be doing to put your body in an environment where it's going to thrive and flourish. Resistance training. Resistance training is key for the muscles. Remember, if you have strong muscles, you have strong bones. And strong bones give us a nice, strong structure to protect our bodies. So you need at least 2 days of resistance training per week. And then lastly, core training is something that we're going to deal with quite a bit in this office. So remember, this is your spine. This is your right hip. This is your left hip. This is your spine, and these are the nerves. Now remember, the muscles that support and protect your spine, they look very, very long, but the reality is this muscle right here is controlled only by the nerve right here. So many of you, do you remember looking at your x-rays and seeing that instead of having a nice curve like this, maybe it was straight or going the opposite direction? And then remember, we saw sometimes some decay or some breakdown. Remember, that's been there for a long, long time. And just as that affected the structure of the bones, it's affected the function of the nerves here. So what we do with your core training is, remember, we're going to use your scans. So we have your scans when you start and your scans at your re-exams, and depending on the differences or the changes that we see, that's how we prescribe the very specific exercises that we give you. Remember, these are long-standing problems. Once we start to adjust you, your body's going to start to heal on its own, but we want to expedite that process, right? We have an agenda. So we use the exercises to help expedite that process. So they're very, very important. We deal with exercises for your spine at least 2 different times during your care. Your diet. So we're going to really deal with your diet after your first re-exam and between your second re-exam. And again, as far as your diet goes, I will be there for you as much as you want me to be there. I'm not here to force nothing but nuts and berries down, into your diet. But when we talk about water, you need water. You need about half your body weight in ounces. Consistency is the key. You want to drink 4 to 8 ounces of water an hour. Remember, your body is always producing waste from breaking down fuel. Just like when you turn your car on, the first thing that happens is exhaust comes out. If you only drink periodically, your body's first priority is to make urine. So if you drink consistently, that's how the water gets into your cells, specifically your disc cells that we need to regenerate. So water is very, very important, and consistency is very, very important as well. Your nutrients, your minerals, your vitamins. So you should all have about 7 to 9 handfuls of veggies a day. Raise your hand if you're doing that. bare minimum 5, but ideally 7 to 9. So if you're not getting that many veggies, it's very hard to do that. We need to have a conversation about how we can get more nutrients, minerals, and vitamins into your body. We can do that through different supplements, but I'd like to do it through your diet ideally. Your essential fatty acids we're going to talk about in just a second. Those are very, very important, but you want to make sure you're buying the right ones. And probiotics are also important too if you have digestive issues or you've had a lot of antibiotics in your lifetime. So when you look at your fish oils, a couple things you want to pay attention to. You have your total fats. You really want the majority of that to come from your poly and your mono unsaturated fats. Those are the healthy ones. Your EPA and your DHA are how concentrated it is. Just like orange juice, you can buy a little thing of orange juice for $3, or you can buy 7 gallons for $1. It's all how the quality of it. So your EPA and your DHA tells you the quality. Above 500 minimum, please. And then it should be molecularly distilled to get the toxins out. And it should come from the bottom of the food chain, like sardines, anchovies, even herring. And it should be wild. If it doesn't say wild, it's not. It's farm raised. So those are all good guidelines to find a good fish oil. I think everyone should be on some sort of fish oil, given most people's diets. Ergonomics. So when we talk about your ergonomics, your ergonomic demands are as different as the patient. So Dave, you're a firefighter. Your ergonomics demands are going to be completely different than, say, a massage therapist's. But no matter what your ergonomic demands are, you just want to use proper posture. And what does that mean? When you look in the mirror, you should see that your nose is right on your belly button. You shouldn't be shifted to the side. You should make sure that your shoulders and your hips perfectly level with the horizon. We want to use the edge of the collarbones. They should be nice and level. And you want to use the top of the hips. If you see that, chances are the spine is fairly healthy. But if we see shifts, then that means there's probably some shifts in the spine as well. About 90% of your brain's energy is used to regulate your posture alone. Everyone remembers this, right? This is the number that I get really excited about. And most of you at this point will, So let's understand this number a little bit better. So there's two numbers, a total energy, which measures how hard your body's working to support and protect your spine. And then there's symmetry, meaning how it's doing it. So we want the amount of energy that it takes to support your spine to go down. So we want your total energy scores to be below 200. And we want your symmetry scores to be close to 100%. So remember this when we go through your re-exams. So that's pretty important for you to understand your progress in your care. Sleep. If you can't sleep, you can't heal. It's especially important for hormones like cortisol and growth hormone. So you need a minimum of 6.5 hours of sleep. If you're a back sleeper, you really want to focus on having a good pillow, making sure that the neck is supported. If you're a side sleeper, you need not only a good pillow, but a good mattress. So when you're sleeping on your back, the ear should be directly over the shoulder. And when you're sleeping on your side, if I'm sleeping on my left side, my nose should be right along line with my belly button. If you're sleeping on your stomach, we need to have a long conversation about how we're going to stop you from sleeping on your subject. There's just no good way of sleeping on your stomach. It'll damage the spine, it'll damage the discs and the nerves, and potentially the artery that runs up through your neck. So, again, no healthy way of sleeping on your stomach. Positive mental attitude. So here's the thing about stress. Our bodies deal with stress very, very well. We deal with stress just like we were a caveman. In other words, when we experience a stressful situation, our body goes into what's called a fight or flight response. And the thing about fight or flight response is it has a huge global response through your entire body, turns on the things that you need for immediate survival and shuts down the things that you don't need. So these are all good things when you're running from your life. For instance, I want my heart rate and my blood pressure and my cholesterol to be up if I'm running from my life, because I need my blood to my muscles that are running. But if I turn my this into an everyday thing where, remember, I'm stressed out about, say, something financial, or I'm stressed about maybe I was injured at work. All these stressors cause the body to react in the same exact way. So these things look like the chronic diseases that most of us, or 60% of us, will eventually encounter if we don't change how we're doing things. So again, Stress is a big deal. So I will give you $100 for someone to bring me back a bucket of stress. You got to fill it to the top with stress. And no, you cannot put your spouse in the bucket. So in other words, there's a perception factor to your stress. But remember, ultimately, it affects your body all in the same way. So again, we go back to this chart. Remember, we want to monitor the part of your nervous system that controls and regulates your organs. We talk about how your spine's like a gigantic fuse box for your entire body. So when we look at your thermal scan, this is something called a dermatome. And every patch of skin in your body is controlled by a specific nerve. So if I was a neurologist and you said, I can't feel these 2 fingers, I know exactly which nerve I want to look at. So remember, we measure the skin temperature on either side of your spine. And if the nerve's healthy, we'll see a white box. If there's some irritation around it, we'll see a green or blue box. And if there's a big disturbance, we'll see a red block. Now the temperature difference is different from side to side because the message getting to the glands and to the blood vessels, which are controlling the temperature of your largest organ, the skin, they're not working the way that they should. But you got to remember that same nerve that goes to your skin also goes to an organ as well. So again, that's a really important part of your care is remember the thing that we glide up and down your skin. That's why we're doing that. We're monitoring the part of the nervous system that goes to the organs. So that's equally as important as the nerves that go to the muscles. Responsibility. You have some responsibilities. You need to be aware of your causes of subluxation. So again, in the room we should be talking about things like, for instance, your ergonomics or the things that are causing you problems. So it's your responsibility to try to avoid those things as much as you possibly can. Your appointments, especially in the beginning, it's really important that you keep your visits consistent. If for whatever reason, if you can't make an appointment, please just give us a call to make sure that we can change our schedule accordingly. Workshops. The more workshops you go to, the better you're going to do. Really, they tell you're only in the office for a short period of time. They tell you more about how to do things outside the office to make sure you're getting the best results. Recommendations. Again, if I give you a recommendation, whether it be with diet, exercise, nutrition, your adjustments, remember, you and I are a team. If I'm recommending something that you know is just not going to happen, we need to have a conversation about that. I can give you the best recommendations in the world, but if they don't fit into your life, they're not going to work. So we either have to change the recommendations or we have to change the perception of the recommendation. So again, we're a team. Open communication. Just like a business, marriage, a team, you and your body, communication is key. No different. Responsibilities. I'm in my office. So most people out in the public think that chiropractic is all about fixing your aches, your pains, your bumps, and your bruises. I rely on you, my patients, to set the record straight for me. I could give people as much information and much research until the cows come home. But really, it's your personal stories and your experiences that makes a difference. Again, we want to make a huge impact on the community as a whole. And the only way that we can do that is by talking about what chiropractic really is. You know, your spine literally is your lifeline. And it's everyone that you know and love should at least have your spine checked. I mean, most of us get our teeth checked every 6 months. And the only thing we do with our teeth is chew. Your spine pretty much does everything. So your spine's your lifeline. It's just that no one has ever told you until today. So thank you for your time and your attention. And I hope that you got some good information out of this. Thank you.
Thank